Thank you, everybody, for joining us today. We're excited to have you here. Unfortunately, Crystal, our normal host, cannot make it. So I am Dina, and I lead the events at BioBuzz. And I'll be hosting this really awesome program for you guys today. So I just want to get started and welcome you to Career Catalyst. This series is part of the BioBuzz Talent Lab, a platform designed to help science professionals like you access exclusive job opportunities, career development resources, and expert advice and industry events. This program is a 45-minute program. It's broken out into two parts. So the first 25 minutes, Rudy will present his deck, and then the last 20 minutes or so, we'll have a Q&A where the recording will be turned off, so you'll feel free to ask any questions you'd like. Please take a moment, if you haven't yet, to mute yourselves. I wanted to thank our sponsors for today's session, Workforce Genetics and BioTrack. Workforce Genetics has been helping connect talent forming teams for over 20 years now, powered by AI, making it faster and easier for growth-oriented, venture-backed life science companies to build great teams without the hassle of cost of traditional recruiting firms. And as always, a big thank you to BioTrack for sponsoring today's session. With over 40 years of expertise, BioTrack workshops have trained more than 19,500 scientists and engaged 300 scientist instructors. Designed by active researchers and open to the scientific community, these workshops equip bench and research scientists with the latest lab techniques and provide training on cutting-edge biotechnology and advancements to a global audience across all biotech sectors. You can learn more at biotrack.com. So now, without further ado, I want to introduce you to Rudy and get started. So Rudy, you can take the stage.
Hello, everyone. Thank you so much again, Dina, and thanks, Krista, who is unfortunately couldn't make it here today. Thanks, BioBuzz, for having me. It's also a privilege to have an opportunity to discuss about different strategies that are working in the clinical research industry. So I am a clinical research career professional and also a career coach and a professional trainer. I've had the opportunity of serving the clinical research industry for the last 15 years. And for the most of my career, I've had the opportunity of working at the site level, which is working in the independent hospital, academic center, and also having an opportunity of working at CROs of pharmaceutical companies. This experience has given me a kind of a well-grounded, overflow of the entire ecosystem as I support clinical research professionals. So in the last couple of years, we've really been creating curriculum, training courses, programs, as well as different strategies to help place and support clinical research professionals who are looking for jobs. But yeah, I'm excited to have the conversation today about career navigation here at BioBuzz. Dina, next slide, please. So I get a lot of questions. Get a lot of questions every week on LinkedIn, and most of the questions about what's the hiring managers are looking for, because companies, individuals who apply for hundreds of jobs. I spoke to somebody a few weeks ago, and she said, I apply to 200 jobs every week. I'm like, and you're still not hired. What exactly is the problem? It's a major problem because right now AI kind of have both good and bad things, right? So just the same way like everything else, but AI has made resume writing so easy that everybody can, whip up a very smooth, breathtaking resume, and that becomes a challenge for hiring managers. Now, when hiring managers are scanning their resumes, they're able to determine exactly to see, okay, what exactly am I expected to get from this candidate? Hiring managers and recruiters don't spend as much time as they should, obviously, because they have a lot of different candidates that they're interviewing. Because if a hiring manager or a recruiter posts a job on LinkedIn and or any other job board for that matter, and they receive 200 plus resumes, then the question is, how will they have the time to review all those resumes? Then, of course, they have to rely on the ATS system to filter the resumes based on certain keywords. But the problem with that is because the fact that these job descriptions are not usually written by recruiters. Job descriptions are being created by the HR managers. I remember when I was a site I was working as senior resource director supervisor for Northwell. I want to post a job, and the hiring man, the HR will write a job description for me, and HR write this job description, of course, because of the company needs, but the hiring manager is the one who is going to be working with this person, and when the hiring managers or the recruiters are looking at the resumes, they want to be able to understand exactly what am I looking at. Does the candidate meet the requirements? Now, yes, keywords alignment and individuals or professionals are able to have their resumes to align with job descriptions. While while that is a good kind of starting point, I always recommend that you want to first of all understand what the job is, right? Because the job description is what was provided, kind of gives kind of overview of what the jobs is, what the role is about. But if you want to be able to understand exactly what is, for example, a CRA position, a clinical research associate. Now, a clinical research associate will have something like site monitoring, but site monitoring is a keyword on the job description, but that's not what is actually what the hiring managers and the recruiters are looking for. Because what the hiring managers and recruiters are looking for is, do you have SIV experience? Do you have IMV experience, COV, and which are all the different site monitoring visits? Now, if an individual update their resume and only have site monitoring because they want to match the job description, then it doesn't really say much because site monitoring doesn't really mean anything, right? But so it's always a good point to, yes, mirror the job description, but also very, very important for you to really understand the role specifically and know that what the responsibilities for that position is, despite what they have on the job description. LinkedIn is also a very good platform. As a matter of fact, LinkedIn has gradually become very, very important in the recruiting and hiring landscape. Excuse me. Because now most hiring managers don't just depend only on the interviews, on the profile, on the resume. They want to be able to take a little bit deeper look into see what this person is all about. Now, the good thing about LinkedIn is that people hardly have fake information on LinkedIn. Or if people come on LinkedIn, they're trying to be as real as possible. And this is a point. This is really a space where hiring managers and recruiters are spend a little bit more time to see. Okay, you have a beautiful resume and everything kind of looks good. Now let's take another look to see your LinkedIn. How does your LinkedIn look? Does your LinkedIn match what you have on your resume? The reason for that, the reason why LinkedIn is becoming sort of a dependable platform is because if an individual posts their profile on LinkedIn, which is tied to their company and the company title and their job title and all of that, there's also a perceived notion that obviously my boss is looking at this or my colleagues are looking at this. So I want to be able to make sure I present my honest self. And that helps hiring managers to be able to say, okay, you know what, if your LinkedIn matches your resume, it might not be the only determining factor, but obviously it then helps them to make a decision if they're going to be able to reach out to the individual or not. Now, what I've also seen a lot for resumes is individuals always want to be able to have more of the duties of what they did, what you did on the job. While that is good, and I was looking at reviewing a resume a few days ago, and I had this candidate who lists over 28 lines, 28 bullet points. Each bullet point had about 4 lines. This is like a 12-page resume. I'm like, what? Yeah, I mean, you're looking for a 12-page resume and you're applying for a CRA position you've been working for the last 8 years. That is not a long time. And that's not a long time, but the goal is be able to frame experiences around scope, impact, result, and what those results meant, what you did, what problem did it solve, right? For example, I did monitoring visits, okay, but the way I'm going to lay that out on my resume is not going to be monitoring, and it's not going to say I did monitoring visits. It's going to be more of, performed 15 IMVs on phase 2 oncology study that led to resolving backlog there, whatever. But the goal is be able to be quantitative, provide quantitative values that that kind of be around the scope, impact, or result of the result that that you did, as compared to just a list of responsibilities listed on the resume. Um, Next slide, please, Tina. Now, with all that being said about how to position resume and how to be on LinkedIn and all that, now the question you always get is, okay, how do I actually, given that I've had the resume and LinkedIn locked in, what's next, right? Job search is a job by itself, and this is what most people kind of fail to understand, because the people take a lot of time to apply for jobs, but especially from a desperation standpoint, when an individual loses their job, I remember when I lost my job, and it took me about 48 hours to start applying for jobs, But when an individual lose their jobs, and they want to get back to the job market, and they start applying for jobs randomly and post it randomly and just post, and at some point you just get to a point where you start applying to jobs, you start applying to everything, right? I get when I talk to folks who are just exhausted, like really at this point I apply to everything that comes up on LinkedIn. While that is, out of frustration, but it's not a strategy. It's always good to have a strategy around job search, because 80% of positions are filled without being posted. And the reason why these roles are filled without being posted is because most companies already kind of have different hiring system. And I know that for most companies, they have kind of a 3 different hiring systems, from the internal promotion or internal movement. For example, a company that says, well, we are looking for a new project manager on our team. Of course, the team members on that call in that team will be aware that their team needs a new project manager. Now, if that team needs a new project manager, they can easily say, we're going to promote somebody internally who has been looking for an opportunity, or who is qualified to take this role. The next thing after that is the next step after that is referrals. Now they can do internal referrals, because companies like to have folks who know themselves to work together. Now here's one of the reasons, at least one of the reasons for that. If my buddy and I are working in some company, if I want to leave the company for whatever reason, it's going to be harder for me to leave if I consider the fact that we're in the company together. It's going to be hard for me to convince them that we should leave the company together, unless like there's something significant happening. But it's really about the fact that companies prefer folks who know each other to work together, because it reduces the amount of just the time that it reduces how people leave the job. Because of course, if companies, if you just leave, it costs the company a lot of money, for the time that they have to hire new folks, and the productivity that they lose in that time frame as well. So this was one of the situations that companies use. But of course, the third tier is now when they post the job outside, which means we've moved from the internal team circulation to the referrals, and now to the third tier. So the third tier is for people like you and I who are outside the company, right? You are applying for this job, so you're really competing for about just 30% of the job with a whole host of individuals as well. But what does that really mean? How can this actually be? How can individuals be able to take action on this? We have access to so much resources, with LinkedIn and different networking events and different networking platforms. I always recommend to individuals, like, always try to reach out to your network. Do not build a network only where you need a job. That's the biggest challenge that professionals are doing right now, because if you have a job, you're comfortable, you get your paycheck, go home and live your life, right? Until when you lose a job, they go, oh my God, where's my LinkedIn account? You then have to go back on LinkedIn and start applying for a job. But the good thing is start creating connections and networking with individuals, even when you do not need a job. So that way you do need a job, even if you don't really have to need a job to build a connection. But if you do need a job at that point, you already kind of have that warm relationship with individuals, right? You have that warm relationship with professionals out there. They trust you so much so that, when you reach out to somebody, it's not like, hey, I'm reaching out because I want to be able to get a job, but you're reaching out to somebody because They believe they've known you. You build that warm relationship with them. For me, for the most part, when somebody reaches out to me on LinkedIn, I say, "Hey, Rudy, I'm looking for a job." They send me a long list of descriptions of themselves and the resume. I'm like, in my mind, I'm like, what? Even if I had a job, why should I give it to you, right? Like if I had a job offer right now, why should I give this job to you? you know and this is just because of the fact that I don't know who this person is, we haven't created a relationship. So to me, they are foreign, and of course it's a very cold relationship. And I can't I you know and that's the same for hiring managers, that's the same for recruiters. So it's always a strategy. And I tell folks, like, if you want to start building a network on LinkedIn or maybe any other social platform, engage. Reach out. We look at recruiters in certain companies, be a list of companies that you're targeting. Look at the recruiters in those companies. And one thing again, I say, LinkedIn give us all this information for free, right? LinkedIn give us all this information for free. We have access to all of this data. We just don't use it. So look at 20 companies, make a list of these 20 companies, look at the recruiters or hiring managers. Well, probably somebody wouldn't say their title is hiring manager, right? But if you see somebody who's a manager, a director, right? Those are some of the folks who are decision makers in that company. Reach out to recruiters. Now connect with them. And if you connect with them, don't just send a connection, send a text. Hey, my name is X, Y, and Z. I'm a clinical research professional. Looking forward to building my network. That's easy, right? At this point, they don't feel pressured. You're not asking for anything. They're not like, they don't feel like, oh, you want to get them. You want to get something out from them. People really love to help, but they don't love to help when you ask. People love to help when they are out of their own decision to help. So when you have an individual where you're able to reach out to connection again, this may not happen overnight, right? You might send a connection request to somebody, to John, and John doesn't come on LinkedIn every day, right? John comes on LinkedIn once a month, and John doesn't respond to your LinkedIn connection. Again, some people might feel frustrated, be like, I really want to talk to John. John didn't respond to me. Really, I don't think this thing is working, right? You can always reach out to John again, or perhaps just wait and constantly reaching out to other people. Now, when you do that, John, our recruiter person, will then be able to respond back to you. But now, even if John doesn't respond and John posts a comment, makes a LinkedIn post, engage with their post, right? Engage with their post. Now, don't just engage and say nice post, right? You want to like their post, and when you like their post, you comment with an insightful comment. Now, when you respond with an insightful comment on their post, here's what happens. John will get a notification on LinkedIn that Mary, you in this space, right? Mary commented on their post. And the natural thing for John to do, and I do it most of the time, the natural thing for John to do is John will come, click on the comment, and check you out. Who is this person who actually commented on my post, right? Now, when John checks you out, LinkedIn gonna let you know that, hey, John checked you out. John checked on your profile. So you see that there's a movement of different there's a cascade of events that happens, but we just completely ignore them. Because when LinkedIn notifies you that somebody comment on your profile, then the best thing for you to do is to go ahead and then be able to message them, right? Then obviously when you have an interview as coming up, interview is not just an opportunity for you to memorize answers to be in the company for a job. Is to really understand develop a framework for your responses. Don't just respond to questions. Don't just be like, okay, I'm expecting them to say this. Have sort of a framework around your responses, so that, for example, if you say my response, I'm going to be using the STAR framework, or you on the STAR framework, on the situation, the task, the action, result. You also want to think about what's the lesson that I learned from that, because not just about the result, you want to think about the lesson you learned and how can you bring that experience, that lesson into the new position that you're seeking to have. Next slide, Tina, please. Now, most people are looking for different opportunities, because we look at those who want to break into clinical research. There's a significant amount of folks who are looking to break into clinical research for multiple reasons. I used to say that for me, before COVID, few people knew what clinical research was all about, but after COVID, it became very prevalent that clinical research is not just it's not just a nice to have. It's not just something that we look at, but it's a whole career. It's a whole career by itself. Credentials is always a good opportunity, to level up your career for professionals who are in the clinical research space looking to move. And the movement timeline is also very, very challenging because we have folks who are clinical research coordinators who are looking to become CRAs. And the question that I get all the time is really, how do I get to become a CRA? Right? I want to move from a CRC to a CRA. It's a very, very challenging question. It's very, very challenging, situation, but obviously it's possible if you use the right strategies to be able to do that, to make that happen. Now, certifications it's always good because certifications also provide you an opportunity to prove that I know a little bit about what's happening. Specialization is also important, and now because the clinical research space, they don't just hire because they want to hire, right? Clinical research professionals or companies, biotech companies or CROs, they hire positions because they want to be able to fill a certain gap in their team, and that's why you're going to be able to see positions like oncology CRA, right, or a CRC who has oncology experience or ophthalmology experience or dermatology experience. Now, this is very important because the industry is hiring based on those very niche basis. Now, they don't just hire a coordinator because if you're a coordinator, right, let's say you're just a coordinator, your title is a coordinator, or you present yourself in your professional summary as a coordinator, and there's another person who present himself as an oncology research coordinator, right? Oncology clinical research coordinator. Now, there's a difference between, and if that company has an oncology study, they will want to pick this person with oncology because they've already specified exactly what their strengths are and what their experiences have been, versus a coordinator who may not be specific in anything. So specialization also becomes very, very crucial. And this is the same for CRAs as well as CTMs as well as other positions as well. We talk about LinkedIn becoming, being your silent recruiter who is then working on your behalf, be able to be out there to be a platform where individuals, professionals can connect with you. I remember one of our candidates that we worked with a few weeks ago, when we started engaging with her, said, let's create one post on LinkedIn. This is you introducing yourself to the research community. And she created one post, and lo and behold, that post had over 600 engagement, 600 likes and comments. She was amazed, like, oh my God, really, what have you done? I said, well, we just kind of exposed you to the world because the world didn't know who you were, right? But LinkedIn gave us an opportunity for us to be able to be out there, because if you make a post, and this is what most people don't do, right? If you make a post, what this tells is so it's decision maker. Somebody might be browsing on LinkedIn. I may come across your post, maybe get something that you post that you're very interested in. Oh, wow, look at this person. But they want to be able to see more about you. They want to be able to learn more about you. And again, when they visit your profile, LinkedIn notifies you that somebody has visited your profile. It's an opportunity for you to also engage with them.